Good morning and welcome to Webinar Wednesdays with Senior Medicare Patrol. We're really happy to have you all here with us this morning to talk about virtual healthcare scams. My name is Sunny Lawless and I'm the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'll be your host for this morning, and then presenting for us today will be Brenda Garrett, who is one of our Community Outreach Specialists in Georgia, and Nathan Coughlin, who is our Georgia team lead and community outreach specialist. And as I mentioned, today for the May installment of Webinar Wednesdays with SMP, we're going to talk about virtual healthcare scams. During the presentation, you're welcome to type any questions that you might have into the chat, but we're going to hold those until the end of the presentation when we open it up for Q&A. There will also be a prize drawing at the end of the presentation today. You must have been registered to attend the webinar prior to 10:15 a.m. in order to be entered, and you do have to be present to win. Before we get started with today's presentation, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. So this is your first time just joining us. Who is Senior Medicare Patrol? Who are we? SMPs are grant-funded projects, as I mentioned, from the Federal Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And the mission of the SMP program is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before we get started with today's presentation, we do have a quick polling question for you. And today's polling question is, have you ever used telemedicine or telehealth services? So have you ever used or had a need to use one of these types of services, telemedicine or telehealth? If you would please go ahead and enter your response now, yes or no, and I'll give everyone just a few seconds to get those answers in. All right, just a few more seconds. Okay, we're going to go ahead and close the poll and launch the results. There we go. So it looks like 51% of you said yes, you have used these types of services, and 49% have said no. So what are telehealth services? Telehealth or telemedicine is a way to receive healthcare using your cell phone, home phone, computer, or other online digital communications. Now I'm going to turn things over to Brenda, who is going to share information about telehealth and telemedicine and how you can protect yourself from fraud when using these types of services. Brenda?
Thank you, Sunny. Telehealth was designed to help patients in rural communities that may not have access to certain types of healthcare specialists. It is designed to help with healthcare gaps and provider shortages by providing access to a specialist through telecommunications while reducing healthcare cost. Next slide, please. There are three main types of telehealth services. Real-time video conversations, such as office visits and consultations with a specialist. This is known as synchronous telehealth. The sharing of patient information between providers, such as X-ray reports and laboratory results, also known as asynchronous telehealth. Remote patient monitoring, also known as telemonitoring, using technology to electronically monitor and transmits patient information such as vital signs or blood sugar testing. Next slide, please. Medicare covers most telehealth services in some form. In many states, Medicaid will follow the Medicare guidelines. As Medicaid coverage is different from state to state, it is always best to check with your provider to determine what telehealth services are covered in your state. Next slide. Medicare telehealth coverage must meet the following 4 primary conditions. The beneficiary must be located in a qualifying rural area. The beneficiary and distant site practitioner must communicate using an interactive audio and video telecommunication system that permits real-time communication. Examples are a telephone or a computer. Next slide. The beneficiary is located at one of 8 types of qualifying originating sites. An originating site is the location where the beneficiary receives the services through a telecommunication system. The site generally must be outside a metropolitan area and must qualify as a Rural Health Professional Shortage Area, HPSA. Next slide, please. The sites may include a physician's office, hospitals, rural health clinics, community mental health centers, skilled nursing facilities, and other specified places of care. A remote site practitioner may be a physician, physician's assistant, nurse practitioner, clinical psychologist, and other health-related professionals. For Medicare to pay for telehealth services, it must be coded Medicare telehealth services. Next slide. Telehealth is not immune to fraud schemes. Just a few of the schemes that have been seen with telehealth are billing for services not received, coding for services at a higher rate, as well as kickbacks and bribes for referrals. There was a large expansion of telehealth services due to the COVID-19 pandemic. Due to this, the Department of Justice has seen an increase in telehealth fraud. Even legitimate telehealth companies may encounter cybersecurity incidents that can expose large volumes of sensitive patient data. Next slide. One area of telehealth fraud is related to cybersecurity. This is when someone falsely acquires your personal information, such as your Medicare number, Social Security number, credit card, or bank information using technology such as the internet. If you want to avoid becoming a victim of telehealth fraud, or you think you've been a victim, you should follow Senior Medicare Patrol's message of prevent, detect, report. We will go deeper into that message at the end of today's presentation. Next slide. Remote patient monitoring for conditions such as those with irregular heart rhythms, patients with hard to manage blood sugar, or after surgery. The patient may wear a monitor and need to log in to the internet or connect with their cell phones to their physician's office as directed. The physician certifies that they have monitored the patient. In cases of fraud, the patient may have been monitored by an unlicensed person, such as a medical assistant, or was not monitored at all. Yet Medicare was billed as if the physician monitored the patient themselves. Next slide. While it's true that there are legitimate uses for RPM that involve using medical devices to remotely monitor patients with chronic medical conditions that may cause them to quickly deteriorate, disreputable companies are enrolling Medicare beneficiaries for this service when it is not medically necessary. So how does the scam work? Medicare beneficiaries may be contacted over the phone or through online advertisements to sign up for RPM services. Equipment for these services in many cases may not even be sent or is not FDA approved. Billing then offers for setup, patient teaching, and monthly monitoring of data. In most cases, the monthly monitoring never happens, yet the beneficiary's Medicare is billed regardless. In many instances, the patient is prescribed durable medical equipment, hospice, or home health services that they do not need. The telehealth company works with telemarketing firms to identify seniors in each area. These are often vulnerable seniors. So how can we fight back? According to the Office of the Inspector General, the following are some ways you can protect yourself or a loved one from falling victim to these RPM scams. Review your explanation of benefits, your EOBs, or Medicare Summary Notice, MSNs, for any services or equipment that you did not order that Medicare is being billed for. And if unordered medical equipment is delivered, do not accept it unless your personal healthcare provider ordered it with your consent. Be suspicious of anyone who offers you free medical equipment and then request your Medicare number. If your personal information is compromised, it may be used in other fraud schemes. Remember, a trusted healthcare provider you know should approve any request for equipment or services to address your medical needs. Next slide. Now that you learned about virtual healthcare scams, Nathan is going to discuss 3 keys to success in stopping healthcare fraud, waste, and abuse. Prevent, detect, and report.
Good morning, everyone. So we are going to get into the prevent, detect, and report side of the SMP message. Next slide, please. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at a doctor's office or pharmacy. Only carry your Medicare card when you know you'll need to use it. And please remember, Medicare will not call you to ask for your Medicare number for any reason. If someone calls you and says they're from Medicare, I want you to be immediately skeptical and hang up. Keep records of all medical visits and procedures that take place and medical equipment that has been ordered. Next slide. The next key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare Summary Notice, MSN, that's if you're on standard Medicare, or if you're on an Advantage plan, you get something called an EOB, Explanation of Benefits. Your Medicare Summary Notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive that EOB after you receive healthcare services. Compare your statements to your personal records and look for the following items: medical appointments you did not attend or were double billed for, medical equipment such as braces, catheters, or diabetic supplies you did not order or did not receive. Next slide, please. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information and report. But who do you report to? We want you to report to us at the SMP hotline number. If you have any questions about your Medicare statements, you can always call your healthcare provider or plan. If you aren't comfortable calling your provider or you aren't satisfied with their response, call the SMP number, the 877-272-8720 number you see on your screen. Next slide. After hearing today's presentation, you might be wondering how you can help and become involved with the Senior Medicare Patrol program to fight fraud. The SMP program is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud and abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. A big part of the SMP program is us going out into the community giving presentations. So also please call that 877 hotline number if you're in Georgia, Mississippi, Louisiana, and Vermont, and we're happy to speak with you about giving a no-cost presentation to your groups. That's always by a staff member or by a volunteer member. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number and we can send a volunteer information packet and answer any questions you might have about the process. Next slide. So we do these volunteer webinars monthly. I know a lot of you in today's webinar, it's your first time. The best way to stay up to date with scams impacting older adults and also about our webinars is following our Facebook pages. You see a QR code on your screen. Just scan the QR code using the camera on your cell phone to be guided to our social media platforms, including Facebook, YouTube, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages are especially a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us from our community partners. Next slide. As mentioned in the previous slides, we have a toll-free hotline number of 877-272-8720. That's once again on your screen. And you can call to report potential healthcare fraud or ask us questions about potential fraud and even request we attend your event or speak to your group on our fraud prevention message. If you're not, there's also our website, stopmedicarefraud.org. If you're in any other state besides Georgia, Louisiana, Mississippi, and Vermont, you can also go to smpresource.org, and that can link you to any of these states' SMP pages and their contact information. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites to your events, allowing us to reach older and disabled adults in your community. Our website can be viewed in multiple languages by adjusting the language tab at the top right of your screen when you visit stopmedicarefraud.org. I want to hand things back over to Sunny.
All right, thank you, Nathan and Brenda, for that information. So coming up next month, as Nathan mentioned, we do webinar Wednesdays every month, and it usually falls on the last Wednesday of the month. Sometimes that changes with holidays. But next month, for the month of June, we're going to be talking about volunteering for the Senior Medicare Patrol Program. And that webinar is going to be held on Wednesday, June 25th at 10:30 Central, 11:30 Eastern. So just be on the lookout for information on how you can register for that event soon. And as I mentioned before we got started, we do a prize drawing for those of you who registered to attend today's webinar prior to 10:15 a.m. this morning. And you do have to be present to win. So winners of our prize drawing receive a $25 Amazon e-gift card, and that is emailed to you. And like I said, you do have to be present to win. So if you give me one moment, I will pull up our little prize wheel. We had a lot of folks register for today's presentation. You do have to be present to win. So let's go ahead and give it a spin and see if we can get a winner this morning. All right, let me just check this to see. Melissa Strauss, if you are on the call. Let's see, I don't see Melissa signed in, so we can give it another spin. Let's see, Jeff Quinn. Okay, it doesn't look like Jeff is here. Let's remove his name. I'll do this maybe one or two more times, and if we still don't have a winner, we might take it offline, and then I'll just contact whoever we pull. Let's see. Jackie Bennett.
Jackie is here.
She is. All right. Congratulations, Jackie. I will be reaching out to you after today's webinar to make sure we have the right information so we can get you your Amazon e-gift card. So congratulations, Jackie. All right, let's see if we can get back to our slides here. There we go. All right, so before we wrap up today's presentation, we do want to open it up to Q&A. If you have a question, you can raise your hand and I'll unmute your line and you can ask. You will be muted yourself, so you will have to unmute your line too.
And one great thing about the SMP program is if you don't feel comfortable asking your question right now or don't have any questions right now, please utilize that 877-272-8720 hotline number to call us later on to address those questions. It's Monday through Friday from 9 to 5. We typically have a live person answer the phone, and we would love to speak with you there as well.
Yes, that is correct. Thank you, Nathan. And I'll also be sending out a thank you email shortly. So if you wanted to ask your question, you could just respond to the email that I send. All right, well, I don't see any questions coming in. So that is going to conclude our presentation today on virtual healthcare scams. As I mentioned, you will be receiving an email from me shortly with a link to a short survey. We would really appreciate it if you would just take a moment to complete the survey just to let the Administration for Community Living know how we did with today's presentation. We do appreciate you joining. Thank you, Brenda and Nathan, for the information, and we hope to see you all again soon. So thank you and take care, everyone.